My grandmother was a like preschool teacher and then a head of the Head Start program for our county for most of my life. And so I spent a lot of time with her at the preschool and just hanging out with kids. And so I always knew that I wanted to work with kids. And then when I was in the 8th grade, I decided to be a doctor, and that was the end of the story, I guess. It's the first time that I've ever seen a family. If there's anything in the medical chart, I try to review it just so I kind of have an idea of, what the patient's experienced before, if they have any medical problems, if they have any medications that they're already on. And then obviously when I'm face to face with the family, I'll kind of review all of that information to make sure it's accurate. But I think in that first appointment, it's really important to build like the rapport and again, make sure that they feel like I'm listening to them and that I am addressing their concerns. I'm pretty passionate about breastfeeding medicine and trying to support mothers through breastfeeding. And then I'm really interested in early childhood development. So making sure we're meeting those early milestones, looking for early signs of autism, because we know that early intervention is the best course of treatment in those cases. And so being able to identify that early is really important. If the kid is able to talk to me verbally, then I always address questions to them. If they're younger, the question might be, what did you have for dinner last night? If they're a teenager, I might be a little more direct in my questioning, and I tell my teenagers it's really important that you feel comfortable being in charge of your own health care. If the kids are little, then I have no problems getting down on the floor, and we have Legos in our office. I'll play Legos with them. Typically in my office, 14 and older, I like to talk to all of the patients alone. And I tell the kids it's to make sure that I'm taking care of everything from head to toe. And again, so they start getting some autonomy regarding their own health care, and they get practice with that, because as soon as they turn 18, they're in charge. And so I think it's important to prepare them for that transition. I love interacting with kids. They come in, they say something funny, or I'll have kids come up and give me hugs, draw me pictures. I mean, that right there makes it worth it.